Insulin is the basis of diabetes treatment. From first year nursing students to final year medical students, everyone must be confident with insulin. Rapid insulins, short acting insulins, intermediate acting, long acting, pre-mixed insulins, insulin pens, pumps, all this becomes very confusing. So today in this presentation, let's understand insulins from absolute basics to the latest modern insulins with their counterpart brand names. This gives a perspective which is useful in your day-to-day management. Insulin is a hormone produced by the beta cells of pancreas. Its job is very simple. It takes sugar from the blood and pushes it into the cells for use as energy. When insulin is absent or there is a receptor level resistance to the action of insulin, the sugar cannot be pushed into the cells, resulting in the rise of blood sugar. This leads to the condition called diabetes. Rapid acting insulins. Rapid acting insulins are insulin analogues. The standard insulin molecule is modified by a few amino acids to make these analogues. Analogues have rapid onset of action within 15 minutes. They can be taken conveniently just before food. The common brands that are available are Lispro, Aspart and Glulicin. Short-acting insulins. Short-acting insulins are the naturally occurring insulins. Atrapid, Hum Insulin are the common brand names. They have an onset of action within 30 to 45 minutes and are commonly used as IV infusions as part of treatment for diabetic ketoacidosis and are also used in developing countries as pre-meal insulin. Intermediate acting insulins. Addition of NPH or the neutral protamine hedron prolongs the T half of insulin and converts the standard insulin into a long acting type. The common brand names that are available are Insulatard, Hum Insulin N and Insugen N. The prolongation of action can be as long as for 12 to 18 hours. They are used as part of pre-mixed insulin like human Mixtard 30-70, where 30 units is short acting and 70 units is long acting in view of the additional NPH in the solution. Just like the previously discussed rapid acting insulins, insulin can also be modified to prolong its action. Long acting insulins, which have a steady basal control for 24 hours, are the newer analogues. Examples include Glargine, which is commonly marketed as Lantus or Basaglar, and Detemir, which is marketed as Levemir. They are used as once daily insulins, usually in the night, for a steady basal control for the 24-hour period. Insulin can also be modified to prolong its action for a very long period. One such example is Degludec, which is available as Tresiba. These have action as long as for 48 hours. They have very low risk of hypoglycemia. Pre-mixed insulins. As has been discussed before, insulins can be combined to make it into combinations. Fast and intermediate acting insulins are combined to make the best of both worlds. They are very popular in the elderly and in OPD basis. The common brands that are available are Mixtard 30-70, Humalog Mix 25 and Novomix 30. Insulin delivery. This can be by using an insulin syringe, insulin pen or an insulin pump. Insulin syringe is a relatively older method of administration and is still practiced in developing countries. Insulin pen, on the other hand, is novel. It has a very fine needle. The pain is very less or negligible and is commonly available and used nowadays. The third option is insulin pump. Insulin pump delivers a continuous low dose of bolus insulin, and before a meal, either by entering the amount of carbohydrate that is being taken or the current sugar value, the insulin pump calculates the required doses of bolus insulin and gives it directly to the patient. This makes the insulin delivery more efficient and sugar control more easier in these patients. Now let's lock in the 5 important points as the word pearls. Regular insulin is the only insulin that has to be used as an IV infusion. Rapid acting insulins are for mealtime coverage, whereas long acting insulins are predominantly used as a basal regimen. If you mix glargine with any other type of insulin in the same syringe, it loses its efficiency. Always rotate injection sites to prevent lipodystrophy in those areas. If you have enjoyed this video, please like and share. With Tanuvu, discover the marvels within.